Well, it's our job to prepare for just that. Storms that are unexpected, storms that we haven't seen in years. And in terms of magnitude, Sandy was just one of those, something that we hadn't seen here in a lifetime or more. And the state's response to that event was particularly challenging because of the general scope and magnitude of the hurricane affecting just virtually every part of the state. But our preparedness activities pre-storm really gave us the tools and the necessary training that we needed to respond effectively, and we did so. EMS and public health, particularly local public health, worked hand in hand mostly in the sheltering initiatives. Medical needs shelters in particular need medical staff to help address the patients and the survivors in those shelters. EMS provides a pretty significant role in fulfilling that mission. First and foremost, they bring patients to the shelter, ones that need transport. They transport patients from the shelter to the hospitals or to other shelters. So being that kind of transportation vehicle, if you will, is a pretty significant role for EMS. This is where we coordinate all of our response activities related to the storm. So in this room, around this room, we have a number of stations which get filled by various staff members and key stakeholders in the healthcare continuum. And what we do is we gather information from all parts of the healthcare continuum, from acute care hospitals to EMS agencies in the field, to local health departments, home health, as well as a number of private sector partners. And we take that information into the Health Command Center and provide real-time situational awareness, very robust situational awareness to the commissioner and her senior staff, which enables them to make important decisions in a timely and efficient manner. So this is really, gives us a great opportunity to synthesize that information in an organized fashion, and provides a great deal of responsiveness and capability and awareness of what's happening around the state. I'll give you one example of how we did that. Is we were coordinating with our county OEM EMS coordinators through this room and through conference calls and a number of communication vehicles that we used to communicate with that group. And it became very apparent that they didn't have the resources needed to serve their community from an EMS perspective, a number of communities. So we were able to get that information, move it through the Commissioner and the Office of Emergency Medical Services, as well as the State Office of Emergency Management, and put a request in for additional resources from other states. And by getting ambulances from other states to help augment our services here in New Jersey in a very timely fashion, no doubt saved lives and impacted the individuals who needed service in the community, who needed help. That's just a great example of how this room really reacts and responds during a disaster. The amount of damage and the sheer magnitude of devastation up and down the coastline was just something I didn't expect, something I personally wasn't prepared to see. And then once you got into the communities and saw the survivors and their faces and what they were going through, what they lost, and then when I visited healthcare community members, such as one of the hospitals in Ocean County, the EMS agencies and squads, what was apparent is that they were survivors too. That while they were providing healthcare services, patient care, answering 911 emergencies, they were from those same communities that were devastated. So there they were providing critical public health service, really making a difference, saving people's lives in many cases. And they too were impacted. And those faces I'll never forget.